Today's medical rounds, heart doctors at Hartford Healthcare have a new tool at their disposal. New 3D mapping technology can now help with certain cardiac surgeries and procedures. And joining me now to talk more about it is Dr. Aneesh Tolat from the Heart and Vascular Institute. Welcome, doctor.
Thanks, Kara. Thanks for having me.
I'm not sure that many have heard of this, but what is ventricular tachycardia and what are the most common causes?
So ventricular tachycardia basically is an arrhythmia or a rapid heartbeat that arises from the ventricle. Generally, people who have a weakened or diseased ventricle are more likely to have this, and it could have been from a heart attack, a viral illness, but essentially someone with a weaker heart. There are patients who have normal hearts that can also have it as well, but when patients have this, it can be a serious problem and sometimes maybe at increased risk for cardiac arrest.
So talk about some of the symptoms and the treatment.
Well, the treatment primarily involves either use of antiarrhythmic medications, specialized medicines to suppress the arrhythmia, or catheter ablation, where we can insert catheters through the groin, thread them up to the heart, and then locate where the arrhythmia is arising from within the ventricle.
And you have some new 3D mapping technology that can help. Tell us about that.
Yeah, so we're really fortunate at the Heart and Vascular Institute here to have something called InHEART, which is basically a new way of imaging the hearts through CT or MRI. Essentially, what it involves is a post-processing that's done by a new company called InHEART in France. The scans are acquired locally in Connecticut at Hartford, and then we send them there for processing. And we're able to visualize where this diseased tissue often is ahead of time.
So what are the benefits of that InHEART technology to patients, and how has it changed the treatment plans?
So the benefits are really quite a lot. So we're able to actually look at these scans of patients before they come into the room for a procedure. We can identify disease within the ventricle, and we can also get information about where other important structures lie, including the coronary arteries, the veins, the nerves, other places where we don't want to be ablating or burning tissue to eliminate the arrhythmia. So this is really going to be a game changer in terms of how we look at procedures.
Game changer is always good for patients in our area. Doctor, thank you so much for sharing your time with us.
Great. Thank you for having me.
And as a reminder, you can always find more information about Hartford Healthcare's Heart and Vascular Institute right on our Channel 3 app.